Good afternoon, and welcome to the 2015 C2P3 Awards for Innovation and Excellence in Public-Private Partnerships. 6 very generous sponsors have joined with the Canadian Council in sponsoring the 2015 awards. PPP Canada is the research coordinator, PricewaterhouseCoopers LLP, our gold sponsor, and 4 silver sponsors, Stonebridge Financial Corporation, National Bank Financial Markets, Dorsey & Whitney LLP, and Norton Rose Fulbright LLP. We very much appreciate your tangible encouragement for Canadian excellence in P3s. I'd also like to thank the awards panel members for their support and hard work. And it is difficult work because they're all good application. Panelists were Joanne Mullen, partner with PwC, Murray Totland, City Manager with the City of Saskatoon, Peter Hepburn, Managing Director and Head of Infrastructure and Project Finance at National Bank Financial Markets, Alain Massicot, partner with Blake's LLP in Montreal, Dr. Alan Russell, Professor and Chair of the Computer Integrated Design and Construction Department of Civil Engineering with UBC in Vancouver, and Rupesh Amin, Senior Vice President, Infrastructure and Development with Forum Equity Partners. This is the 18th edition of the National Awards for Innovation Excellence in P3s. They were established in 1998 for 2 key purposes. First, to celebrate the achievements of government sponsors at all levels, along with their private sector partners. And second, to provide models to inspire other partnerships both in Canada and abroad. And Canada does have an excellent reputation in P3s abroad, and it's great to see such an international audience here with us today. As well as celebrating the achievements of the award winners, the Council documents significant partnerships through case studies. These case studies are intended to enhance our understanding of P3s and help others to develop successful P3s. These case studies are distributed to the Council's 400-plus member organizations, both the business community and governments across Canada. You can also find the summaries on the Council's website. So enough from me, and on with the awards.
Now, ladies and gentlemen, please welcome Peter Hepburn, Head and Managing Director, Infrastructure and Project Finance, National Bank Financial Markets.
Good afternoon. My job is to introduce or to give the award for the Gold Infrastructure Humber River Hospital, the Gold Award for the Humber River Hospital. The new Humber River Hospital facility is North America's first lean, green, and fully digital hospital. It consolidates 3 existing facilities, 2 of which will close and 1 which will convert into an ambulatory care center with also an urgent care center into a single new site. It will serve a large catchment area of roughly 850,000 residents in northwest Toronto. The new facility is 1.8 million square feet in size and includes inpatient and outpatient care, cancer care, cardiac and critical care, emergency, dialysis, bariatric surgical services, women's and children's services, diabetes, and mental health programs.
It's a great pleasure for me to accept this award on behalf of everyone at Humber River Hospital. For me personally, as President and CEO, it's especially gratifying to see our planning team and our project partners recognized by the Council for their hard work. Our vision was to create a new model of care for patients and families, one that put them at the center of the entire hospital experience. This model would use the capabilities of a fully digital hospital to reinvent patient care by incorporating cutting-edge technology into every aspect of healthcare delivery. We knew that was a new way of thinking about hospital design, construction, and function. It would be challenging and would require us to partner with bold, innovative organizations. Now, when I see the new building, I'm amazed at how quickly our vision is coming to life. I'm proud of so many aspects of this project. Most important, of course, is what it will let us do for our patients. I would like to take the opportunity to thank our partners, Mike Marasco and Plenary Health Care Partnership, for their commitment and guidance. I would also like to thank the teams at the Ministry of Health and Infrastructure Ontario. They have been instrumental in helping us deliver this project. Finally, I'd like to thank our hospital board, our foundation, and my entire hospital team for their hard work, not just on this project, but every day for our patients and their families. This is the second time our project has been recognized by the Council. We are grateful to them for this recognition. In conclusion, I'd like to take this opportunity to repeat what I said in accepting the first Council Award. Don't be afraid to look past conventional wisdom, as we have done here. It's amazing what can be accomplished when you surround yourself with the best and brightest and focus on outcomes. Thank you again to the Council for this recognition.
On behalf of Infrastructure Ontario, it's an honor to accept the Gold Infrastructure Award for the Humber River Hospital project. Humber River Hospital is one of the largest at 1.8 million square feet and most technologically advanced hospitals we have had the opportunity to help deliver on time and on budget using our AFP model. The great Humber River team, led by Ruben Devlin and Barb Collins, had a forward-thinking vision for their new hospital: lean, green, and digital. Lean, to deliver health care in an efficient manner that respects the investments made by the government for the people of Ontario. Green, to deliver health care in a facility that is built to respect the environment we live in and demonstrates leadership as good stewards of the environment. And digital, to deliver health care with equipment and systems that are modern and reflect the best practices for delivery of technologically advanced health care. In partnership with the Ministry of Health and Long-Term Care, Humber River Hospital and IO worked tirelessly to tender and manage a very complex project that would challenge our best builders. The experienced Plenary Health Care Partnership team that included Plenary Health and its partners PCL Constructors and Johnson Controls met this challenge head-on. They successfully delivered on Humber River's objective to create North America's first digital hospital. The new hospital is an example of the best-in-class public infrastructure that can be delivered through public-private partnerships. When Humber River Hospital opened its doors to patients 2 weeks ago, it was truly a proud moment. Thank you again for this award, and thank you for recognizing the incredible teams that helped deliver one of Canada's finest healthcare institutions.
Humber River Hospital has a lot of firsts, being Canada's first fully digital hospital designed to be both lean and green. We are honored to win the Gold Award for infrastructure for this complex and challenging project. Good projects don't happen by themselves. They're the result of hard work by a number of people, and I'd like to recognize them. First of all, I'd like to thank our team at Plenary Health Care Partnerships, consisting of Plenary Group, HCP, Social Infrastructure, Innisfree, PCL Constructors, and Johnson Controls. I'd also like to thank the team at Infrastructure Ontario, who guided us through the procurement process and construction phase. Last but not least, I'd like to recognize and thank our partners at Humber River for their amazing vision and their hard work in building this amazing facility. There are so many unique features noteworthy of this hospital that make it stand out as a best-in-class PPP deserving of this year's Infrastructure Award. The project itself is one of the largest hospitals in North America at 1.8 million square feet and was designed to be at the forefront of innovation from a building perspective, but also from a healthcare delivery perspective. The first challenge of the facility design was to integrate the operations of 3 distinct old facilities into one efficient new facility and make a big hospital seem small. This presented a significant number of design challenges which were resolved through the expertise of partners and the development of a user group process to engage the hospital's 35 departments. This lean, green, and digital facility will be at the forefront of providing excellent patient care in an efficient and sustainable manner. The vision was established by the hospital team, and Plenary Health Care Partnerships has delivered. The new hospital is truly one for the digital age and is a leader in North America in this respect. Finally, this project is an example of how great facility design, underpinned by effective risk transfer and the involvement of expert private sector partners, can actually change and improve the way in which an organization operates. This is true in the infection control designs, department layouts, and mostly in the operating room design and use, thanks to the powerful analytical tools provided by GE Healthcare.
To accept this award on behalf of the partners is Dr. Ruben Devlin, President and CEO of the Humber River Hospital, Angelo Gismondi, Vice President Project Delivery at Infrastructure Ontario, and Mike Marasco, CEO for Plenary Concessions.
Congratulations to all of the winners. And once again, I'd like to thank our sponsors, PPP Canada, PricewaterhouseCoopers, Stonebridge Financial Corporation, National Bank Financial Markets, Dorsey and Whitney, and Norton Rose Fulbright. That brings us to the conclusion of our awards for this year. And Mark, ahead of schedule, actually.